Prison is not meant to be pleasant or even terribly comfortable, but it's also not meant to be where prisoners die from a highly infectious global pandemic. Joining us now on what's been happening with COVID-19 and prison populations, both of them in the downtown core of the provincial capital, we welcome Abby Deschman, Canadian Justice Program Director at the CCLA, the Canadian Civil Liberties Association, and Lee Chappelle, President of Canadian Prison Consulting, Inc., an advocacy and reform-based firm. And we're glad to have both of you folks back on our program here tonight on TVO. Abby, the CCLA has just gotten into this space by writing a report on the current situation. Why don't we just start there? Tell us why you wanted to write this report.
Sure. So, we've been really deeply concerned about the people who are incarcerated in Canada since the outset of this pandemic. We know that congregate facilities like prisons, like homeless shelters, like cruise ships even, are really at very high risk for rapid spread of COVID. And so we've been focusing on prisons, what they are doing to mitigate the risks to people who are behind bars since the outset. Right now, though, the people who are incarcerated in Canada are really facing a perfect storm. We have new variants of COVID that are more transmissible, that are many instances more deadly, causing more severe illness in new populations. We also have increasing incarceration rates. So at the beginning of the pandemic, many jurisdictions very rapidly decreased the number of people behind bars. We think they could have done more, but there was an impressive push to get people supervised in the community wherever possible. That has let up. We have seen more people going to jail, being incarcerated, in fact, now than at the height of the first wave. And then third, we still haven't seen vaccines hit our prisons yet. That is changing. They are targeted for April, the second wave, so we are starting in on vaccinating prisoners, but we have not made significant inroads, as far as we know, in getting vaccines into people behind bars.
Okay, good summation. Lee, I wonder if you could pick up on that and tell us from your vantage point what you think this pandemic has revealed about the state of our prisons.
Okay, Steve. Yeah, certainly. I agree on the early end of this. In Ontario, I can speak to for the Ministry of Attorney General, Crowns, Justices, Defense Counsel. They were all very attentive and worked together towards lowering the threshold for bails, lowering numbers within our jails. I think it's a compassion fatigue that has set in over the course of this for a lot of us. And I don't think it's any different for the criminal justice system. Many of my clients who've been on bail for years have been sentenced over the last 4 to 5, 6 months. To my dismay, I don't quite understand the reasoning, and I believe Corrections is inheriting the numbers, and they're not thrilled with it either.
We've got these numbers here, and at the risk of inundating our viewers and listeners with them, they do make the point, though, that you both have just made. So, Sheldon, I'll ask you to bring this graphic up right now. And for those listening on podcast and who can't read these, I'm going to go through them in a little bit of detail. We're comparing Correctional Services Canada, so these are federal, longer sentences, with Ontario, so shorter sentences. And we're going to go back to February 2020, so pre-pandemic. And this is the prisoner count. Okay, we started almost 14,000, down a bit as you go to June 2020. So almost 14,000 to 13,000 to 12,700 by September 2020 and 12,500 by today. So the numbers are trending in that lower direction that Abby referenced. However, look at the Ontario numbers. We start back in Feb 2020 with 8,200 prison population. Go to June 2020, 5,800, right? Big reduction. September, starting to creep up, 6,300. And today, 7,100. So the numbers took a dip in Ontario, a big dip in June 2020, but they have started to come back up. And Abby, that's where I'm going to ask you to pick up on the story because you referenced that in your first answer. Why is that happening?
Yeah, so it's a different scene federally and provincially. So federally, we have seen this slow decrease of people behind bars. That's actually not because the federal system is doing a particularly good job at releasing people who are at risk from COVID or releasing people who would be very effectively supervised in the community. That's mostly because trials have stopped. Many trials are not moving forward. So they aren't seeing the inflow into the federal system. And at the same time, they are releasing people as as required by law. So that's the normal outflow from the federal system. And what's decreasing federally is the people aren't getting sentenced to 2 years or more at the same rates that they were. Provincially, we did see a significant reduction primarily in the pretrial population. So those are people facing charges who have not yet been found guilty. That's the majority of people in our Ontario provincial jails. And we've seen a let up of the pressure, the intensity to make sure that those pretrial populations in particular are kept low. Most of those people are facing nonviolent charges, allegations. Most of the people in our jails and detention centers, as I said, have not been found guilty of anything. Most people in provincial jails, they are there for a matter of days, a week. It just makes absolutely no sense to have this population churning through our jails, coming into a very vulnerable congregate setting, and then being pushed back out into the community to wait for their trial. It's a recipe for death and illness.
That's where I want to pick up with Lee. I wonder how concerned you are, Lee, about the fact that while the numbers started to go down in the Ontario, in other words, 2 years less a day population, but now the numbers are starting to go up significantly.
Well, Steve, I think I can cut through that pretty quickly. It's not so much pretrial time at this point. We have a growing reservoir in Ontario provincial corrections of federal inmates. We have not had transfers in the largest region of Canada to the Ontario Region Reception Centre essentially since last November. So I have clients that were sentenced 5 months ago that are still in provincial awaiting transfer to federal. The Central North Correctional Centre has become a reservoir with a huge number of federal inmates. So therefore the federal inmates, you know, on the counts, they're showing provincial, they're federal. So it's a matter of the COVID outbreak that happened in Joyceville Reception Assessment Unit in December, followed by subsequent Ontario provincial outbreaks, and just this real effort to try to juggle how do we move people and transfer people without spreading. And again, case in point, but that's why the numbers are skewed.
Let's just put this on the record here, because we did receive a statement from Correctional Service Canada on this, and it reads in part, we'll take a little excerpt from it because it was a very long statement. Correctional Service Canada and the Parole Board of Canada continue to process eligible inmates for release in accordance with the law. On average, they say, 600 offenders are released a month. This occurs through parole, statutory release, or expiration of sentence. Since the beginning of March 2020, so more than a year ago, the federal custody population has declined by more than 1,500 inmates. This reduction is the result of fewer admissions from the provinces and territories, coupled with continued releases into the community. This downward trend in the federal inmate population is expected to continue over the coming months. Lee, your reaction to that?
Well, I think it's a false read. Again, so we're not having the transfers, and I can speak to Ontario Region, which is our largest populated, 40% of Canada. We have a massive reservoir of federal inmates that are backlogged and logjammed that have not been able to make it to federal. Therefore, they've not been able to start the classification process. They've not been able to move forward with anything productive. Most are serving low-end federal sentences. And again, I point to the criminal justice system for putting these sentencings through when we were going through the second and third waves for people who had been on bails. I don't understand the thought process when it comes to not adjourning until we get a better handle on this, and until we are, maybe this fall, it looks like with vaccines that we'll be there. But I think there's about to be an explosion of numbers from my understanding and insight once they're able to transfer safely. They're federal inmates from the provincial institutions who have been waiting for months upon months to get there.
I see. Abby, does this suggest, the way the numbers are going in a downward direction in the middle of a global pandemic, does it suggest that we are putting people in jail for whatever period of time who in essence are not violent, are not a threat to the general population, and maybe don't need to be there? I don't know. You tell me.
I mean, that was the case before the pandemic, right? We were putting people in jail for nonviolent crimes. People were regularly sentenced to jail because of drug-related offenses, because they had breached their bail conditions, which often isn't a crime in and of itself outside of the bail system. So yes, we regularly do that. And what's really disappointing, federally, I'll speak to that first, is that this is business as usual, right? Those releases from the federal system, that's the number of people that would have been released in the normal course of things if there weren't a pandemic. We have seen outside of the prison system enormous rearrangements of our daily lives, of schools, of society, of businesses, in order to try to protect people, to try and prevent the spread of COVID. That same urgency has not translated into releases from prisons wherever possible, feasible, and safe.
You know, Lee, all right, let me play hard ass for a second here. If you can't do the crime and you don't want to do the time, you know, no, sorry, I blew that. Let me get the expression right here. If you don't want to do the time, don't do the crime. What about those who will listen to this and say, look, there's an easy way to stay out of jail. Don't break the law.
Yeah, well, I think it's a fair point, and I think what we need to do is shift. And again, when I keep referencing the criminal justice system and corrections inheriting the issues, I can say from working hand in hand with corrections officials, whether it be frontliner management administrations, they're under considerable strain, and they're not asking for this increase or for people to come. And I understand Abby's point of feeling that there should be more releasing. There is a backup there also because programs haven't been running. They have in the federal system what they call correctional plans, and they discern intervention needs. So whether it's anger management, whether it's substance abuse, whatever mitigating factor, with the programs not running, parole boards and corrections are not adapting very well to saying, well, you haven't received this program, so you are now not going to get a parole.
Abby, we have certainly heard about outbreaks at manufacturing facilities. We've heard at food processing facilities. Have you heard about too many outbreaks in our jails?
Absolutely. So, we know from data from February in our federal system, for example, that infection rates behind bars are 5 times higher than they are in the community. The latest count we have, it's a bit hard to keep track because not all of the provinces release comprehensive data on COVID infections in their correctional systems, but over 7,000 cases linked to prisons and jails across the country, over 5,000 of those related to prisoners themselves. And, when an infection does get behind bars, there is a very high risk that it will spread rapidly. A few of the outbreaks over the second wave, so December, early January, one in Saskatchewan had over a third of prisoners in one institution get ill from COVID. Even worse outbreaks in Manitoba. So absolutely, it is worse behind bars than it is in the community. Okay,
but here's the key follow-up. Lee, I'll put this to you. I know there are going to be people watching or listening to this saying, well, if there's a COVID outbreak behind jail, that's not going to affect me, so who cares? So the question is there a danger if there's an outbreak behind bars of it spreading to the general population outside the prisons?
Steve, I've almost turned into an epidemiologist when it comes to this. I've done so much homework for clients over the course of the last year. What is clear to me is the congregate settings, unlike a cruise ship, and if we look back to the beginning stages of this, the cruise ships that stayed at sea for months upon months and nobody wanted them to disembark in their countries, that's a good example. Our prisons and our jails have people coming and going daily. So therefore, it automatically represents a concern and a threat to the communities where these prisons and jails are located. So it's very easily transferable. It's not just isolated to the institution, but the surrounding communities, and it's a legitimate concern for everybody.
So that's why everyone should care?
Yes.
Got it. Let me do a follow-up with you, Lee. In terms of the routines of the average prisoner behind bars, how have those routines changed in a post-pandemic world?
Dramatically. So we've been living under a state of emergency in Ontario for the most part. I think we were talking about that earlier, but the impact has been considerable. So visits haven't been happening, in-person visits for the most part, for more than a year. Families are unable to see loved ones, and vice versa. The programming that they run hasn't been running. It's been running, minimally at best. So it's backlogged. Transfers to the federal system are backlogged. We're having a growing backlog right now and when it comes to haircuts, fresh air, phone calls, the list is long. It's a very restrictive nature. So Corrections is doing everything they can with guidance from Health Canada, I believe, in keeping people as distanced as they can. They're trying, but what it's resulting in is very restrictive conditions for inmate populations. And they have tried. The federal system has done a number of positive things. They've increased video visitability for and able to do something like we're doing right now for someone a couple times a month to be able to see their loved ones. That is a key. Provincial does not have that opportunity, and they have reduced long distance phone call costs. So there's a number of things that they're trying to do, but I mean, again, it's been extremely restrictive, and it's just not allowed for progress or rehabilitative measures.
Yeah, Abby, I'm trying to wonder here, if you're in a prison and you're, I don't know, 2, 3, 4 to a cell, how do you physically distance and try to stay safe vis-a-vis COVID-19 under those circumstances?
Well, you can't, right? And I think this is really the key. The primary message we've heard again and again for over a year now is physically distance, isolate yourself as much as possible. Don't mix outside of your immediate social circle, your household, unless you get the number of people in those institutions down. That is absolutely impossible. In Saskatchewan, when they had an outbreak in the second wave at Saskatchewan Penitentiary, they didn't have the ability to isolate people. There were people who were ill with COVID who were in the same ranges. They tried to hang plastic sheets duct taped to cell bars as their infection control measure, and then gave up on that, right? So you cannot manage these outbreaks in a congregate setting with institutions holding the number of people they typically hold.
Abby, I know in a perfect world, anybody who needed or wanted a vaccine should be able to get one whenever they want. We don't live in a perfect world, so we are having to prioritize who gets what vaccines when. Where are prisoners at the moment on the priority list?
So most jurisdictions have them in the second phase of their vaccine rollout. So that is, they are a congregate setting, right? So they're prioritized along with other congregate settings that don't hold primarily elderly people. So that should be happening now in most jurisdictions, but it's difficult. It is going to be difficult, particularly in the provincial institutions, to make sure that everybody is vaccinated, because people do come in and out of those institutions so quickly. You know, if you have a turnover really rapidly, the fact that public health went last week doesn't necessarily mean that next week you're going to have a protected population in a lot of those provincial institutions. And then just healthcare delivery is hard in prisons. There can be a lot of mistrust between people behind bars and healthcare professionals, and that's going to impact the information they perceive and how they view the information they're getting.
That's exactly what I wanted to follow up with Lee on. You know how the average prisoner thinks, Lee. For those who haven't been on this program watching you before,
right?
You've done some time, so you understand how this works. How much mistrust would there be between prisoner and health? Would it be significant enough to the point where prisoners don't want vaccines because they're not sure what's in them?
That is part of it, and I can speak to one client that I have whose mom is an RPN.
What's an RPN?
A registered practitioner nurse.
Okay.
So she's well versed and been on the front lines of COVID in the hospital in the Niagara region. And her advice to her son in the provincial. So Abby's right. Provincially, they ran a tour, institution to institution with vaccines, and it's a transient nature, so they weren't able to keep them on site, but they rolled through the province and offered vaccines to everybody that were within. So credit to Solgen on that behalf and their healthcare My client turned it down. The reason behind turning it down was in case he had an allergic reaction. In a provincial institution, you will not be able to access healthcare, and it would be a very serious thing. He's awaiting transfer to federal, and I can say that as recently as April 7th or 9th, the Commissioner of the Correctional Service of Canada, Ann Kelly, circulated a memo to all federal prisons that very clearly said that within the next couple of weeks, they intend to have the Moderna vaccine on site in all federal prisons in Canada for both staff and inmates and for everybody who wants a vaccine. So it has been happening. It sure looks like the federal system's on the precipice of being able to vaccinate everybody who needs it. And I think it's just important staff, obviously, as it is inmates. And provincially, it's far more challenging due to the transient nature.
Abby, we're down to our last minute here. Let me give it to you. What would you like to see happen with inmates going forward?
Well, I think we need to light a fire again. The vaccines are not going to come in time to protect everybody from the third wave. The third wave is already here. So we need to have everybody from police to prosecutors to the judiciary to corrections officials really focusing on keeping people out of those institutions wherever possible, and releasing the people that can be safely released into the community. And then we need to put a focus on the vaccines, right? Ultimately, that is going to provide protection for people who are detained, who are not going to be released. And it's really an urgent crisis.
Okay, Lee, how about you on that same question?
Well, I think from a very practical perspective, I would like to see positives stemming from what's been a real adversity for all of us, and a look inward and retooling corrections so that we can minimally reduce the single bunking across the board. This is not for people who are conservative and tough on crime. We're talking about a 6 by 10 foot cell. It's not austere by any means. But again, I think from a practical perspective, if we can reduce to straightforward single bunking, that would be really, really important. And also if we can somehow direct more releases where the community supports are in place and it's safe to do so, I think we should be moving on that.
Abby Deschman from the CCLA, Lee Chappelle, Canadian Prison Consulting. We're grateful that both of you could spare some time for us on TVO tonight to talk about the state of COVID-19 in our prisons. Thanks to you both, and stay safe out there.
Thank you, Steve.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.